I'm quite pleased with the results of this study because it does show that childhood immunizations, immunizations given up to the age of 2, have increased across the United States over the past several years. This is really important because it helps us prevent certain diseases like pertussis or diphtheria and measles, where if we didn't have that immunity, we would be seeing these diseases reappear. When we looked at our data in Nebraska, we do run a little bit higher from our claims data than the nation. I think that that is probably because our practices here in Nebraska have really been focusing on childhood immunizations for the past couple of years and are really looking at all of those opportunities in which to vaccinate the children when they come in. So if the child is late for their 4-month appointment, they're going ahead and taking those missed opportunities when they come in for a follow-up of an ear infection or a sore throat to go ahead and vaccinate the child when they come in. You know, I think it's different for each state depending on the percentage of children who may receive their vaccines at public health departments or at free vaccine clinics. Sometimes we don't get those claims in, so the children may be immunized, but we don't have a way of knowing that they've been immunized. It also may be that there may be just a lower socioeconomic population within the state, and it's harder to get the kids to the doctor's office to get the vaccinations. In the past, the refusal rate has been higher. When there was fear that vaccinations were linked to autism, I think we had actually a higher refusal rate. But now that the studies have proved that they are not linked, I think it's more personal choice. And I think if a patient has concerns about vaccinating their children, they really need to talk with their physicians about that, because their physicians can give them a lot of education and resources in order to make them feel more comfortable about the vaccinations. It's also really important just to make sure that you come in routinely for the well baby checks, because that's the opportunity to discuss with your physician and to make sure that your immunizations are updated. The flu vaccine is recommended for any child over the age of 6 months, and although we didn't measure it with this Health of America survey, it is a recommended vaccination, and we really just need to do a better job of trying to immunize all populations against the flu. It is particularly dangerous for the elderly and the very young, and in order to protect those vulnerable populations, we all need to be vaccinated for the flu. Childhood immunizations are very important for our population in Nebraska to make sure that our young folks are healthy and that we don't see a rise in measles and pertussis. And so take the opportunity to get your childhood immunizations, talk to your physician about questions that you might have with that, and make sure that you keep your well baby appointments.